That, Francis, now, as you heard earlier on during a live press briefing, the World Health Organization reporting that 183,000 infections worldwide, the highest ever to be recorded in a day, reported, and the WHO saying that it sees new clusters in South Africa linked to clubs and shelters, as well as China also reporting a new cluster of infections, of which they say some are imported. The numbers are going up in South and Central America as well. There's also a growing concern around rising figures in Africa, including countries like Benin and Eritrea. The rising numbers are said to be because countries are peaking, and there's also increasing testing. To talk about South Africa's own situation and, of course, the vaccine trials, we're joined now by public health specialist Dr. Kerrin Begg to talk about this and what exactly we're doing. Thank you so much, Dr. Kerrin Begg, for joining us. She is with the University of the Western Cape. So, Dr. Begg, what the World Health Organization was saying about countries peaking and increasing testing. We saw, for instance, in South Africa alone, more than 14,000 cases that were reported. How does this compare with other models that other countries had in relation to where we are with the disease?
Thank you, and good evening to all your listeners and viewers. So we are certainly we've seen these escalating numbers over the past few weeks. Particularly, we started on our rapid escalation from about Easter, and week on week we've been increasing. We've obviously had to take into account when we've had testing backlogs, as that then has an impact on our assessment of cases, and also our testing strategies. So we know that that as the Western Cape have been focused on clusters and a very strategic testing strategy, so they've got Western Cape has had an increased testing case detection rate versus the rest of the country. But we are seeing that as we are heading to the peak in the Western Cape, so Gauteng and Eastern Cape have had dramatic increases in numbers. And that's notwithstanding, particularly in the Eastern Cape, a backlog in testing. So Western Cape have now caught up with the backlog. There's currently a quick turnaround in test numbers. So those numbers are reasonably accurate at the moment. But we are seeing that rapid increase. In fact, right now, Gauteng sitting with more or less the same number as active cases as the Western Cape. And the trajectory is looking even steeper than the Western Cape's initial increase. So our pattern is looking very similar to the rest of the world in terms of the epidemic.
WHO speaking about the need to understand the behavioral differences of the disease. Now, I want you to please just, in layman's terms, explain when we talk about clusters of the disease, for instance, the Western Cape saying it is important to have the exact date of the peak. And why is that important? How does this help its public health response to at least bringing down the numbers?
So the understanding where we are in the epidemic is important about what kind of measures, public health measures, we need to put in place. So that's important around preparation for hospitalizations and ICU admissions. But it's also important to know when to escalate the non-pharmaceutical interventions, the NPIs. And so there was a very early campaign in the Western Cape to really strongly emphasize the NPIs, because you're really wanting to not only prevent cases, but actually prevent those who may get infected with severe disease. And we know now from the data that we've picked up in the Western Cape that those over 55, we had thought it might be older, but actually we know that over 55, as well as comorbidities, tend to have a higher chance of needing admission and ICU facilities. And so it's really important to try and prevent those admissions in particular, as we know that young people and those without comorbidities have a much higher chance of either being asymptomatic or having very mild symptoms and being able to manage at home. But even there, it's important that the virus stops its transmission route with those individual infections. So the more people can stay at home, the more people can continue with the non-pharmaceutical interventions of physical distancing, masking, and stopping the reproduction rate of the virus. So in other words, the number of people that get infected from one case, that's really important to continue.
So when we talk about those non-pharmaceutical interventions, the WHO giving a directive on the use of masks, when to use them, and how, what are we looking at in South Africa? We have seen a lot of non-compliance of masks, but I also understand from a human perspective, people are saying they're very difficult to breathe in, and in itself it creates some sort of respiratory pressure. So what are we following with regards to that?
So masks, remember that what we've been suggesting for quite some time, and WHO have been one of the last to change over to this, but the evidence is very clear that medical masks and N95 respirators are still the best in terms of preventing infection. However, they need to be restricted because of their limited supply to healthcare workers who are in desperate need of them as they treat patients with COVID-19.
Okay, before we run out of time, Dr. Begg, I want to talk about the vaccine trials. There's been a lot said about BCG and criticism of that. Dexamethasone has also been spoken about. Where are we in terms of vaccine trials in South Africa?
So we are jointly working with around the world in big collaborations with around 130 vaccine vaccine options, and so we are participating in those options. The BCG trial is a slightly different perspective to the vaccine. So the vaccine would be against to protect against COVID infection specifically. The BCG vaccine is a real outlier in that there was an ecological study that showed that countries who have universal BCG vaccination appear to have lower rates of COVID infection, but that could be affected by a number of confounders. And so it's very, very superficial evidence around the protection of BCG, but we have nevertheless got 100 participants in Cape Town on that particular trial, which will only have results towards the end of next year. But in fact, the more effective vaccination that we likely will build an immune response against the SARS-CoV-2 virus itself. We may start to see some effective vaccines emerging round about the first quarter of next year.
All right,
but vaccines take a long time to develop and a long time to demonstrate effectiveness at a population level.
Thank you so much for your time, Dr. Begg. I do wish we had more time. Dr. Kerrin Begg is a public health specialist at the University of the Western Cape. Let's take a quick break. We'll be back shortly.